Hey there, I'm Julia, and today let's talk about breast augmentation, the most desirable surgery ever. Have you done it? Not yet? Why? What's holding you back? Let me know in comments or in private message. Meanwhile, let's talk to Dr. Derby Sang from Dominican Republic. He will tell us about pros and cons about breastfeeding, about recovery time, and will answer a bunch of other questions about this beautiful part of our body. Let's go! Dr. Derby-san, so great to see you. How are you today?
I'm doing great. How about you?
I'm doing even better because summer is coming and we have 10 beautiful questions, frequently asked questions from our customers. And,
Okay.
because out there, so many information about breast implants, it's the top of the requested
Yeah.
procedures ever. So when you Google it, you have so many results and sometimes opinions are so different. You
hmm
can be confused a little or a lot, depends. That's why it's good to talk to a doctor who can say this is true, this is false.
Yes. Especially the breast implants, they after the liposuction, they are the most frequently done plastic surgery performed, not in the U.S., not only in the U.S. but here also too.
Yes. Okay, doctor. So the first question is, what types of breast augmentation exist?
Okay. Basically, there are three types of breast augmentation. The first one, which is the most frequently used, is the silicone implants by using the silicone implants. The second one is by using the saline implants, and the third one is that by using the fat transfer to the breast tissue, which I don't recommend and I do not perform.
Why
Um,
not?
I will explain why. Basically, because the fat transfer to the breast can be later confused with regular exams that you do for breast cancer. They can make a lot of confusion, and that's maybe the main reason why I try not to do it. Um, the breast implants, the silicone breast implants, they are covered with a shell of silicone, and then they are filled out with a gel, a very thick gel that is very similar to the touch of the fat, the human fat. So the other one, the fat, the saline implants, they are filled during the surgery with saline water, and they are basically indicated to for women under from 18 to 20 years old, and that is very commonly used in the U.S. The saline implants. So basically, we
Okay.
have the three types: the silicone, the saline, and the fat transfer.
So which one is better? Which one I should choose if I want them to look natural?
Well, the most common use are the silicone implants. Many women they believe that the silicone implants they not also look more natural, but they also feel more natural. They
Hmm.
feel more like the natural breast tissue. Yes.
Okay. And how to choose the right size?
How to choose the right size? That's a very good question, and that can often bring a lot of confusion. Plastic surgeon who is certificated should make a very good recommendation about this by taking in consideration a lot of things like the previous breast anatomy, okay, the body type, and especially also the frame. And there are a lot of some other factors that have to take in consideration, like the elasticity of the breast, and if the woman had previously breastfed their children. Those are the consideration that the surgeon have to take before a recommended a size of implant size. Okay.
Okay. So it's hard to say immediately like one size, two size. It's you need to see
Yeah, you
to
need to see
suggest.
a lot of things before you suggest one size. I always tell my patient that you cannot choose the same size of a friend that who already had a surgery because it will not be the same result.
Okay, different body needs different.
Type.
Okay, doctor. So, how long will implants last? Because many women afraid that boobs will sag with time.
Okay, in general, it is thought that implants, they have to be replaced after 10 years. Okay, many companies, they suggest that they should be removed after replaced after 10 years. But there's not a specific time where you should go into another surgery. Uh, what we recommend is to get done an MRI every 3 years. And but what most people do is that they do a mammogram every year to see the the condition of the implants, if they are intact or they have a rupture, so they need to be replaced. That's the way that it should be approached. Every 10 years should be the should you should go into surgery to do a replacement of the surgery of the implants. And well, another thing, well, they will sag over time. Your boobs, they will sag over time, but it has to be a natural sagging. Okay, some
Okay.
patients, they will experience some changes during pregnancy of their body, including the breast, and after breastfeeding. Other
Ah,
patients,
so
yeah,
can I breastfeed with the implants?
absolutely yes. Yeah, you can breastfeed, but we know that the milk that you produce, that the patient produce, is going to be a little bit less, and it is related to the scar tissue that is formed into the breast tissue. So the the patient, yes, they can breastfeed, but it will be less milk than usual.
Okay, that's the only issue, just less milk.
Yeah, less milk. It will be the only issue, and it is not always.
Okay. Doctor, what are do's and don'ts during recovery?
Okay, let's start with don't, because they are more important. Try not to sleep. Don't sleep laying on your belly, because it can hurt your surgery, and well, it can hurt your surgery. Well, try not to go to swim to the pool, to a lake or ocean, because by that we're trying to avoid any infection of the wounds. Another don't is don't smoke. We actually recommend don't smoke 2 months before the surgery and 1 month after surgery, because smoking is related to a lot of complication after surgery, especially having open wounds and infections.
What about alcohol, wine or tequila?
Yeah, you can drink alcohol, but not during the first 2 weeks, because you will be taking antibiotics and all the kind of drugs that can be uh, can interact with the alcohol.
Okay, and how long I cannot swim and sleep on my belly?
We recommend that for at least 8 weeks, 2 months.
Okay, okay.
Yes.
And do's, any specific
And
recommendations?
yes, well, try to get some a lot of rest. Anytime that you have a surgery, you need to rest, to let your body heal by resting, and try to eat healthy. It is important to eat always healthy, but especially after surgery. Um, well, try to sleep laying on your back, and you can use a pillow underneath your legs, just to bend over a little bit your leg, so you don't have too much pressure on your surgery.
Mm-hmm.
Basically, those are the two.
Okay. Doctor, what if my body will reject the implants?
It is not very common that a rejection of the implant, although we have seen that. But if that happens, we will have to remove the implants and wait at least 6 months to do another revision or another surgery, where we can use another type of implants, which will be or either saline or silicone.
Okay, do you give any guarantee for your work?
Well, the guarantee is because we try not to use the word guarantee, because we cannot expect some results. And maybe talking about the implants, we can do the guarantee of the implants, but not about the results.
Okay, so if I'm in US and I have some troubles, uh, how the problem can be resolved?
Well, the best way is to come here. is to fly here and try to resolve it here, because in the U.S. sometimes they don't want to touch the surgery of another surgeon, especially if it is a surgeon from another country. I will always recommend to come
Okay, but as you say before, the percentage is quite low, like very small.
here. Yeah, it's a very very low percentage that happens. That complication happens, and it is a very rare.
Okay, doctor, are there restrictions for having breast augmentation, such as
Okay,
age or health condition?
okay. The restriction of having all the patients that have realistic expectation and that is in good health condition should be considered a good candidate for the breast augmentation. Okay, patient with some kind of illness or battling with an infection, or that have a mammogram study that reveals something there, like cancer, should not be considered to undergo to a breast augmentation. And obviously, patient with unrealistic expectation should not be considered to go to breast augmentation.
What is a unrealistic expectation?
Yeah, sometimes patients they and it is because of the social media. They can see a photo, a result of another person or another woman, and they want that result, exactly that result. And we know as a surgeon that we cannot give that result. That's the patient that I'm talking
Mm,
about that should not be considered.
okay, doctor, when can I start to work out after operation, after
Okay,
surgery?
after surgery. Okay, I usually recommend my patients to not to work out for at least 8 weeks. After 8 weeks, they can start by light exercise like walking or swimming, and then after that they can start doing a more um, intense or heavy exercise after 8 weeks.
Okay, what is pro and con of having breast augmentation?
Okay, the pros are it should increase the self-esteem of the patient. They feel better about themselves. They look better, they feel better, and the self-esteem actually is increased. The pros, another pro is that the breast implants, they can be changed or replaced anytime. If the patient that consider that she doesn't want anymore to have the implant, it is a very simple surgery to remove the implant. um, Another pro is that there are a lot of size and shapes of implants that we can choose to get the desired result that the patient wants. Now let's go with the consequence. There are risks involved, like the capsular contracture is one of the risks. Asymmetry,
And
the loss.
first one, capsule contraction, what is it?
Yeah, the capsular contracture of the implant is like a capsule that is formed around the implant that usually is soft, but sometimes it's not like that, and it makes pressure over the implant, and
Okay.
that can make some deformities
Mm-hmm.
and also can give pain to the patient. So that is called the capsular contracture. So
Okay.
it is one of the complications related to the breast implants. Another one is the loss of the sensitivity of the nipple.
Mm.
It is seen very rarely, but it happens, and sometimes it's permanent. In 10 or 15% of the patients, it is permanent, and the patient should know about that. Um, what else? Another consequence of having um, the breast implants is that we can end up having some asymmetry because we chose a kind of implant that will not go with your type of body. So that's something that should be avoided.
Okay. Doctor, what else is important to know before having the surgery?
Well, it is important to know that before having a breast augmentation, you should consider a certified plastic surgeon of your area that have the experience in this kind of surgery, that can make a good recommendation of the selection of the implant. it is important that you know that they are not forever. The implants that they have to be replaced every 10 or more
Mm-hmm.
years. So you will be going to surgery every 10 or more. And especially, well, and that you should have a very good communication with your doctor about all the details that entails this surgery, because you will be having um, for an device, a medical device in your body, and you should have all your studies of your breast all the years, especially the mammogram.
Mm-hmm.
And when patients have the breast implants, the mammogram can be confused also. So that's an important thing that the patient needs to know, because the silicon implants and the saline implants, they can white out the image, and some lesions in the mammogram, they also can be confused with another thing. Okay.
Okay. Okay, doctor. Thank you very much for your answers.
Yeah, you're welcome.